Let's cut through the week one overwhelm of nursing school because your nursing instructors will not wait to hit you with full on NCLEX style test questions just because you don't know anything about nursing yet. And if you think you're going to learn how to answer NCLEX style test questions in your nursing school lectures, yeah, they're not going to teach you how to do this. But don't worry, because I'm about to walk you through some tricky nursing fundamentals test questions that you might see on your very first nursing test. Let's get started. I failed my first nursing school quiz, and it's because nursing school is like being thrown in the deep end of the pool, and your instructors just kind of stand around and watch you and grade you to see whether you sink or swim. And the test questions you get are a big part of the reason why it feels this way. We'll read the question and answers together. I'll tell you the correct answer, and then I'll walk you through the rationales for not only why the correct answer is correct, but why the wrong answers are wrong. And I'll point out the tricky test-taking strategy that makes these questions more challenging than anything you've ever tried before nursing school. Question 1. The nurse is working as part of an interdisciplinary team in a hospital setting. Which action by the nurse best demonstrates the role of an advocate for the client? A. Ensuring that the client's dietary preferences are communicated to the dietary department. B. Coordinating with the physical therapist to schedule rehabilitation sessions. C. Discussing the client's wishes for end-of-life care with the healthcare provider. Or D. Administering the medications as prescribed to the client. The correct answer is C. Discussing the client's wishes for end-of-life care with the healthcare provider. In order to be able to answer this question, we need to know, what does it mean to be an advocate? That's something you're going to be learning in your first semester nursing fundamentals course. But notice the question doesn't just say, what is an advocate? That's because this is a higher level difficulty question where it wants you to apply or analyze the information that you have learned. In nursing school, it's never only about memorizing and regurgitating information. So instead of looking for a definition of advocate in the answer options, we're looking for an example of something that represents what an advocate is or does. And like I said, in order to be able to do that, we do first have to know what an advocate is. These questions are a lot easier to answer when you've been studying with my Silver Bullet study system, because knowing what an advocate is step 1 of that study system. And thinking through a lot of the scenarios, how that could apply, is built into step 3. A is not being an advocate because you're simply passing on a message. And being an advocate means showing public support for a cause or policy. B, coordinating with physical therapists is also not an example of being an advocate. This is simply acting like a secretary, managing the schedule. D is definitely a role of the nurse, like being an advocate, but it is not the role of advocate. Therefore, that is incorrect. Which leaves us with C, discussing the client's wishes for end-of-life care with the healthcare provider. Especially because it mentions an interdisciplinary team in the question, it's important that the nurse act as a sort of champion for the client. And this can involve making sure that their wishes are known to other members of the interdisciplinary team so that they can be respected. I have an upcoming video on NCLEX questions about ethics, which is another chapter you'll be getting to soon in fundamentals. And we'll discuss some things about why that's so important in that video. Number 2, a nurse is reviewing the American Nurses Association, ANA, Standards of Professional Nursing Practice. Which component is included in these standards? A, guidelines for the development of hospital policies and procedures. B, criteria for evaluating the quality of nursing practice. C, regulations for state-specific nurse licensure requirements. Or D, procedures for disciplinary actions against nurses. The correct answer is B, criteria for evaluating the quality of nursing practice. In this question, you need to know a little bit about what the American Nurses Association, or ANA, is, what their role is, and what the standards of professional nursing practice are. Another thing that makes a first semester nursing fundamentals course a little more difficult is that there is a lot of new information you've never heard of before. It's like a whole new world, new language, new culture, which means that although you'll hear me say over and over that you are not in nursing school to be tested on what you know, you're being tested on how to think about what you know. There is still going to be a lot of memorization in your nursing fundamentals class because you're building that step 1 knowledge foundation in your Silver Bullet study system. And this question is a great example of that. You don't have to have every single standard of professional nursing practice by the ANA memorized to get this question correct, though. But you do need to have a basic understanding of how it works and what its role is. I think of the ANA standards a little bit like the Pirates Code in Pirates of the Caribbean, in that they're more like suggestions. Of course, they're very strong suggestions that a lot of people choose to follow. But these standards are not legally binding unless your particular state has decided to make it so. However, even if they are not legally binding, these are things that are generally accepted as making your practice full of integrity and quality, which is why it is important to know some of the specifics, including how you would get in trouble if you fail to live up to those standards. Now, since this is legally regulated on a state-to-state basis, or country if you live in Canada, then while your school may ask some state-specific questions about what your nursing practice guidelines are, NCLEX is going to only ask basic things that would be true of everywhere. So in my opinion, to get comfortably passing grades, just stick with the generalities and you'll be fine. Once we understand all that, it's easier to narrow down the answer choices. A is incorrect because the ANA guidelines are not required to develop hospital policies and procedures. They definitely do not regulate the state-specific nurse licensure requirements. That's done on a state-to-state basis. And they do not provide specific procedures for disciplinary actions. What they do provide is a criteria for evaluating the quality of nursing practice. And state boards of nursing may use that criteria to then develop their own procedures. But that's not what the ANA does, and the question is asking about the ANA standards. And that's why the correct answer is B. Number 3, a registered nurse is considering advancing their career by pursuing a specialized role. Which of the following is a recognized advanced practice registered nurse, APRN, role? A, clinical nurse leader, CNL, B, nurse educator, C, nurse practitioner, NP, or D, nurse manager? The correct answer for this question is C, nurse practitioner. This question is actually an example of a lower difficulty level question that you might see in a nursing fundamentals class. That's because it's more of a recognition or recall type question. Basically, did you memorize what the advanced practice registered nurse roles are? If you did, then you're going to remember that, oh, it's a nurse practitioner. If you did not, then it might be a little more challenging to figure out what the answer is. And that's because all of these roles really could be considered advanced. It's not something you're going to come out of nursing school and do. However, the term advanced practice registered nurse has a very specific definition in that it requires a graduate degree and it's only associated with one of 4 specific roles. That would be clinical nurse specialist, certified nurse midwife, certified registered nurse anesthetist, and ta-da, nurse practitioner. That does not mean that the other roles do not have graduate degree requirements. Often, nurse educator will be a master's or doctorate level degree as well. But by definition, we don't consider that an advanced practiced nurse. Number 4, the nurse is attending a seminar about the historical evolution of nursing. Which statement by the nurse indicates an understanding of the development of professional nursing roles? A, nursing practice was first recognized as a profession in the early 1800s with Florence Nightingale's contributions. B, the establishment of nursing licensure laws in the 20th century was a key factor in professionalizing nursing. C, nursing education has remained largely unchanged since the early days of the profession. Or D, the development of nursing research began in the 21st century. The correct answer to this question is B, the establishment of nursing licensure laws in the 20th century was a key factor in professionalizing nursing. The history of nursing is something that you will review in your early days of a nursing fundamentals course. However, as you can see, it's still not just as straightforward as what is this fact? They make it a more difficult question by asking you to apply or analyze the information. In order to correctly answer this, you have to have studied enough to have a general overview of the progression of the history of nursing so that you can recognize which of these are correct statements and which of them are false statements. When you see Florence Nightingale's name in the correct time period, you may think this is correct. She is, after all, considered the mother of modern nursing. However, when she worked as a nurse, nursing practice was still not recognized as a profession. Therefore, A is incorrect. C, that one should be pretty easy to throw out because nursing education has certainly changed a lot since the early days of the profession, so we can cross that out. D, the development of nursing research began in the 21st century. That is false because nursing research was happening a lot earlier than that. Even Nurse Flo was doing some basic research. Therefore, the correct answer is B, the establishment of nursing licensure laws in the 20th century was a key factor in professionalizing nursing, which is true. Once we were able to standardize nursing licensure laws, it helped to create a status quo that made it easier for others to recognize nursing as a real profession. Number 5, the nurse is preparing a presentation on evidence-based practice, EBP. Which statement best describes the concept of EBP? A, A, it relies solely on clinical expertise and experience. B, it integrates the best available research evidence with clinical expertise and patient preferences. C, it focuses exclusively on the use of randomized controlled trials and clinical decision-making. Or D, it emphasizes the traditional methods of nursing practice over new research findings. The correct answer to this question is B, integrates the best available research evidence with clinical expertise and patient preferences. This question is lower on the difficulty scale because you can see how it's basically asking for a simple definition of evidence-based practice. So there's less application and analysis thinking needed, which is what makes most nursing questions a higher level of difficulty. There are a few keywords in these answer choices that make it easier to cross them out. These types of keywords you're probably not going to see on the real NCLEX, but it's pretty common to see them on your nursing tests. So you can use that little testing hack to help you improve your grades. For example, option A says it relies solely on clinical expertise. Any kind of extreme words are usually not going to be the correct answer. And in this case, it's true. Evidence-based practice is a mix of the best research we have available, which is not always complete, and combining it with everyday clinical experience of actually working with clients firsthand. And it's that combination that makes the best evidence-based practice. So it can't solely be on the clinical experience side. C, we see that word exclusively. This is the opposite of A because this is saying exclusively using randomized controlled trials, which is excellent research, but it does not take into consideration the clinical expertise. Therefore, C is incorrect. D does not have one of those extreme words. However, it says we focus on the traditional methods versus new research findings. And that is not true. We want to incorporate new practices as we learn them, not simply do the same old thing because that's how it's always been done. Therefore, B is correct. If those questions felt tricky until you heard the explanation, that's not a sign that you need to study more. But it is a sign you need to study differently. Because the secret to confidently answering nursing questions is not memorizing more facts. It's learning how to study in a way that actually trains your brain to think like a nurse. And that's exactly what I'm going to teach you in the next video, where I walk you through the silver bullet study system, which is the method I use to help my tutoring students get comfortably passing grades while still having a life outside of nursing school. Before you watch it, tell me in the comments, what was your score? How many questions did you get right? Then I will see you over in the next video.